Hi, this is Dr. Nikitow. What I want to talk to you about in this little video is the importance of doing the proper examination and x-ray of your spine. You know, oftentimes the patients come in to see me and they've gone to a chiropractor. There's two types of chiropractors. We do full spinal correction on a three-dimensional basis called the Cartesian coordinate system, which I've mentioned on previous videos. But what's important is we also take an x-ray of your spine to see kind of what's happening as far as deviations in the spine, because you have to understand how spinal correction works. Okay, some chiropractors, they are just musculoskeletal, they pop your back for joint pain, but they don't really fix your spine. Your spine has to be in proper alignment this way, where from the back, it's straight down this from the back, and then it's got three arcs to distribute stress like a spring. Now, when you look at what happens here in the basis of how we correct spines is changing what we call nerve muscle memory. Now, the way God made us, we're supposed to have equal firing of nerves from side to side and from front to back, okay? That way we establish these proper alignments and curves, okay? If nerves are overfiring to one side because of either postural habits, like you're leaning all the time to one side or the other, or you've injured yourself where the receptors are overfiring to one side, over time those muscles are going to start to get dominant because nerves tell muscles how to pull and muscles hold bones. Chiropractors never move bones into place. We never set bones. We never do that. What we do is we trigger nerves to tell muscles how to pull, and then the muscle pulls the bone into place. So if your chiropractor isn't telling you that, it's very, very important you understand this, okay? Because we do full spinal correction to put your spine back the way God intended it to be in its proper alignment. Now, the way we do that is once we identify this pattern, like this would be the right side and this would be the left side, so this person's pelvis is shifting to the right, what we would do is then give them exercise and adjustments to the opposite side to fire off these nerves until these nerves begin to grow more fibers, okay? Same thing with the neck. If we look at the neck, the neck should be curved so the spinal cord relaxes, there's a proper angle here, both nerves are firing equal. If, like a whiplash occurs, the nerves in the front overfire and they shut down in the back, pulling the spine into this position, which is abnormal, because then you get abnormal compression to the disjoint nerve. The spinal cord, instead of having a nice relaxed wrinkle like in our palm, gets tense. And when it gets into tension, it flattens, it begins to break down. This is one of the leading causes of headaches because you're jamming this first bone right up against the skull. And with that comes things like sinus problems, depression, anxiety, irritability, ADHD, a whole list of different things, because this has a big control center. Once we identify this, we can do adjustments to get this nerve to fire. And once this nerve begins to fire, it's going to grow more branches, and then it's going to pull the spine back into this proper alignment. So again, it's extremely important that you take x-rays. Let's take a look at a couple of the patients that we've seen in the past and show you the importance of having the x-rays based on their testimonials. Okay, so this gentleman was a post-polio victim. He came into our office, kind of walked funny. We checked his spine. He had a crooked spine. If you notice, this point is way off the center line. So this is the right side, this is the left side, reviewing the person from the back. The nerves on this side are overfiring, pulling his head way over to the side, so he had a lot of neck pain, headaches, having numbness and tingling in his fingers. He had a crooked spine here. It was way crooked on the lower end over here where the nerves were firing too much over here. After about a 6-month period of time where we worked with him, look at his spine here afterwards. Now it's perfectly straight, and the guy has no more pain, no more problem, anything like that after we've fixed him. This young boy, 19 years old, came out of high school. He was debilitated, and the reason was because he had so many digestive problems, he couldn't even function. Nobody could figure out what was wrong with him. All the medical tests were negative. We took a look at his spine, and we took x-rays, and this is what we saw. We saw here that his neck on the left was way, way out of alignment. He was crooked all the way down here. These are the nerves that affect the colon, and so do these. And within just a short period of time of about 3 months, his spine was perfectly straight, and his digestion was functioning absolutely normal. But again, we had to identify by x-ray where he was, because you can't treat what you can't see. So it's very important. If you're going to a chiropractor, didn't take an x-ray, you need to get with someone so they can see inside. Otherwise, you could be having a wheel out of alignment for a long time and wearing and tearing, but no symptom until finally it completely falls off the car, if you know what I mean as an analogy, okay? This young boy came to us at 12 years old, had scoliosis. They wanted to put rods in his back. The mother saw me on the internet, and she says, "I see you do spinal correction." And I says, yes. She goes, okay, because all the other chiropractors I've seen just talk about symptoms. So if you can fix my son's spine, that would be phenomenal. Because they wanted to put rods in his back. Well, in 5 months, he was perfectly straight. Now he's 6'6". I don't know where he would have been after 12 years old if we hadn't have fixed his spine. So when we look at things like this, what you have to do is you have to be able to see an x-ray of the spine before the chiropractor can even make a proper assessment as to what to do. Then secondly, you have to do this three-dimensional Cartesian coordinate system so you can make sure that every single dimension is being taken care of. Those are the things that we do in our clinic. So if you're struggling with any kind of problems, you're not sure what your spine looks like, it's really important to get the frame in the game. Let's make sure you get a checkup. So if you're interested, or if you have friends, if you're a current patient, if you have friends who are struggling with any types of these issues, just remember, if the spine's out of alignment, you're blocking impulses and messages from the brain as it's trying to control every single function of your body. That's what chiropractic is. It's not about back pain, although we're great with it. It's about making sure your nerves are free of any interference so the brain can send signals and control all the parts of the body at its optimum. So if you have any kind of problems like that, please call our office and we'll be more than happy to give you a checkup.